Hi everybody, my name's Nat. I'm from Children's Nursing Queensland and I'm a nurse and stomal therapist, and I'm here with Associate Professor Bhavesh Patel, and we're here today to talk about some of the expectations with gastrostomies, and we're talking today about surgical gastrostomies. So Dr. Bhavesh, they've had the surgery, they've woken up and they've been discharged from home. What are some of the things that families need to keep in mind throughout that process, and what happens next?
There's that first week where the button may not be used. I usually use it for medications. There's that initial getting used to and sleep patterns and understanding what happens, and if you've got a button that's sitting here, does it get yanked and pulled? So there's a bit of observation that's required in that first week, I would say. After that first week, they need to see their teams, they need to understand how they're going to be using the button and create some sort of a plan to move forward. So that's dietitian, their pediatrician, whoever's involved from the start in terms of wanting this button in the first place.
So you put it in, but as far as what goes down the tube, that's more the responsibility of the dietitian or the pediatrician, or even, I guess, families sometimes if they're using it for things like fluids and that sort of
Correct.
thing. Yeah.
Consider me in this role as the plumber. I'm the technician. I'm just creating the mechanism to be able to deliver the feeds.
And so when they come out of surgery, will they have a dressing over the top of this?
They have a full dressing. It's completely covered. Depending on the situation, sometimes I will, if I have a button in place, then I will connect it up and then put all the dressings over it. So you've got your mechanism.
A tube probably like this one, I imagine?
Something like this. So what I will do is, once the button's in order to facilitate medication, the button will be in and then this will be connected with that way. So I'll have it connected. There'll be a full dressing over the top.
Okay. And that dressing, are they allowed to get it wet?
Not initially. So probably for the first 24 hours or so, I'd rather keep it dry. After that, I don't mind. Sponge bath is okay. I wouldn't soak in a full bath, but getting a little bit wet, I'm okay with that.
And if families are worried that their dressing might look a bit yucky or there's a bit of ooze on it, what should they do?
Initially, it will ooze, and that's expected. You'll see some blood staining around the outside. If it's a whole lot, as in if it's completely leaked out, you'll see that in the first 24 hours. So you're usually already on the ward, and the nurses on the ward will see something and we'll have to decide what to do with that. And that might be taking the dressings down and having a look, reinforcing the dressings. In that first week, it's really important to make sure that you've got someone you can call. And so that would be your supporting nursing service. And that's exactly what they're there for, is to provide that immediate support.
Yeah, I think, as a nursing provider, that's really what we offer. So we encourage families to do things like take a photo and email it through, and we can often just really quickly review that, make a quick phone call with the family, and either provide reassurance or sort of come up with some alternative action plan if we need. So you get to sort of day 7 to 10. What happens on that day?
So day 7 to 10 is usually the time where you've already pre-arranged a visit with your supporting nursing service. And that's when you start your regime.
Yeah.
So there should be a plan in place from your dietitian and your pediatric team, and the nursing team is who will start enacting that and then
I think it's a very exciting day because you get to take off the dressings. We get to have a really good look to see how it's all healed. Often as well, if they have like a nasogastric tube and they tolerate their gastrostomy feeds, we can take out the tube, which is a really exciting day for families, I think, getting rid of that one. I think we often get questions about, what that process looks like afterwards. And I think knowing that families have ongoing support is really important. So it's not just at that day, that's when you learn to use it. Like you said, it's a journey. So they'll often still need a little bit of support learning how to use it. What about things like going back to school, swimming, sports? They're probably the other 3 big questions we get.
Normally I'd say getting it wet, usually around a week, and that includes swimming. I normally say after any surgical procedure, usually about 2 weeks before they can get back into sports, and so that still stands. And so if they're doing really vigorous activity, then I'd still wait another week. But you can get it wet in a week.
Great. So then it's sort of back to however they feel comfortable with that process.
Correct.
Great.
Yeah.
Okay, rapid fire questions that we often get from families.
Yep.
So first one is about turning the devices. After their surgery, should families be turning the gastrostomy?
I don't think it's necessary, especially in the first couple of weeks afterwards. After that, it's more about the ability to turn the device easily.
It indicates it might be in the safest place.
Correct. One of the things that can happen is as the child is growing, if the balloon starts migrating out and becomes tight, and if you can't turn it, that's a problem.
What about after the surgery? Should families check that balloon port?
Checking the balloon, I don't know that it's necessary. If it's sitting in the right place, then I think you can safely assume that it's working. The balloons are designed to stay inflated, and you're putting water in the balloon, not air. And so if you use air, then sometimes the air can sort of leak away. But this is watertight.
Excellent. And I guess, once families are taught how to change these devices, we teach them that anyway. And so sometimes we might need to decrease or increase the balloon volume, but typically the first few times we like to teach families how to do it in a safe way. How often do you change these devices?
About 6 months to 12 months is an okay time to change the buttons. Sometimes the button mechanism starts wearing. There's a little valve in here that prevents it from leaking. So sometimes the valve starts deteriorating. And so depending on how often it's being used and how often it's being connected.
Excellent. Well, thanks, Bhavesh, for talking with us today. I think it's really important that these conversations happen, with families and with surgeons and with nurses and anyone else who's going to really play an active role in this sort of feed-in tube journey. Thanks, everybody, for listening to us today. If you'd like some more information, you're welcome to reach out. You can find us at Children's Nursing Queensland or Better Kids Surgery on all of the socials. Thank you so much. Thanks, everybody, for listening to us today. If you'd like some more information, you're welcome to reach out. You can find us at Children's Nursing Queensland or Better Kids Surgery on all of the socials. Thank you so much.